All right, let's now bring in Professor Benjamin Smart, Center for Philosophy and Medicine at the University of Johannesburg. Thank you so much for your time, Dr. Smart. So the Health Minister, speaking to him just now, your reaction, please, just on the progress that you think the South African government has been making, particularly the Health Ministry, following that announcement of the PEPFAR funding ceasing.
Yes, I'm often quite critical of government and Dr. Motsoaledi, but in this particular instance, I think it's important to note that I really feel like government are doing everything that they possibly can in this scenario, and actually I think that a lot of the points that Dr. Motsoaledi made are completely valid. It's certainly true that the entire HIV program is not collapsing. But also, just a point of correction, just before you introduced Dr. Motsoaledi, you said that 5% of the funding was going, that's 7.9 billion, but it's not 5%, it's 17%. And 8,000 people is a lot of people. All of that money goes towards, it doesn't fund the ARVs, as Dr. Motsoaledi just pointed out, it funds staff, and actually some clinics have shut down. And whilst it's true that, sure, the program's not collapsing, it does significantly affect an awful lot of people. And there have been many reports of people that have gone weeks without receiving their ARVs. And, a very short period of time without ARVs can have a substantive effect on one's health. So I think government have been put in a very difficult position, and they're doing what they can, which is to transfer those patients from PEPFAR-funded clinics to government-funded clinics, and now they're looking for further funding. So whilst it's reasonable to ask people not to panic and not to exaggerate the situation, it should also be emphasised that this does have a material impact that needs to be mitigated.
And in fact, a number of organizations had also, reached out to the minister and, just raising their concerns, and in fact wrote to him, saying while South Africa self-finances the majority of its HIV services, it is the largest recipient of the PEPFAR funds globally. What concerns do you also have, in as far as the shortfall is concerned, particularly when we start looking at the research component of things?
Well, I think one of two things needs to happen. Okay, either you need to make the systems more efficient, or you need to find money to plug the gap. So I know that they've already been working on ways to make the system more efficient. So, for example, people can now come and collect several more months' worth of ARVs than they could previously. But if they can't find the money to fund that gap, then that money is going to have to come from other healthcare services. And of course, this results in a wider impact on the healthcare system. So yeah, I mean, I don't really know exactly how this is going to be resolved. I just hope the government are able to find the funding and ensure that those people that were previously being serviced by PEPFAR-funded clinics know exactly where to go, and hopefully those previously PEPFAR-funded clinics can be replaced in the same locations by government-funded or perhaps clinics funded by some other resource, like the Gates Foundation or Bill and Melinda Gates Foundation or whatever the case might be.
And I mean, Prof, when we look at just the statistics around how we are dealing with this and consider what Stats SA had revealed, South Africa having the highest number of people living with HIV in Africa, with almost 8 million people infected with the virus, and then having listened to Minister Motsoaledi saying that 5.7 million people on ARVs, government is funding 90%. That is positive in a way, but one then worries about the shortfall. And as you also say, that it is of concern, of course, to see if we will get this funding. But what is happening on the ground as we speak in terms of just the reality that many South Africans are facing that are living with HIV/AIDS?
Well, for most people living with HIV/AIDS, the situation hasn't changed. Most people are not going to PEPFAR-funded clinics, and most people are able to receive their ARVs as normal, as usual. The problem is the people that aren't the most people, and a lot of the time the PEPFAR clinics were servicing special groups within the population, LGBT communities, sex workers, and so on. Now these groups are now going to have to go elsewhere to find treatment, and it's important for them to find out where they're supposed to go, and so on and so forth. But the reality is that some of those people have not been able to, or at least just haven't gone out and got their ARVs. There were reports of drug users and so on. Again, they're sort of, generally speaking, particular communities, and it's mostly affected really the most vulnerable of an already vulnerable group.
Yeah, and the linkages to care, for communities affected by not only HIV/AIDS but also TB and even cancer at some instances.
Well, the link between HIV and TB is stark. You're much more prone to tuberculosis if you are HIV positive. But again, if the HIV is suppressed by ARVs, then that problem, it's less problematic. So again, to reduce the mortality rates of TB in the country, we have to really sort out this middle number. They talk about this 95, 95, 95, right? So 95% of people with HIV being identified, 95% of them being on ARVs, and 95% of them having achieved viral suppression. Unfortunately, we're not doing so well with the middle number. That is the number of people that have been identified with HIV that are on antiretrovirals. That for us stands at 79% instead of 95%. We really need to drive that number up. And again, the minister is, so far as I'm aware, on top of this. He has a special program underway. I think it's called Close the Gap. And they're driving to get that number up to the 95. And if we can get to 95, 95, 95, then all being well, by 2030, South Africa can really have the HIV epidemic under control. And that will have obviously impacts on tuberculosis mortality.